Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Local anesthesia classification, and this is totally based on the duration of the action. So first is short action. So what is present in terms of the short acting? This short action, the time we are referring to is about 25 to 45 minutes. And what are the drugs here? So in short acting, the drugs, it includes the procaine. So there is presence of procaine, and next another drug called the chloroprocaine. Chloroprocaine. So procaine and the chloroprocaine, they are short, that is 20 to 45 minutes. Next is we move on to the category known as the intermediate. Intermediate, the category is about 60 to 120 minutes. So it's 60 to 120 minutes, that is 1 to 2 hours. So what are the drugs here? The drugs here includes the lidocaine. So there is lidocaine, there is mepivacaine. So lidocaine, mepivacaine. So there is lidocaine, there is mepivacaine, as well as there is presence of the prilocaine. Then we move on to the long acting. So by long acting, we refer to the duration of 400 to 450 minutes. So it means it is about 400 to 450 minutes. So what are the drugs? The drugs involves the tetracaine. So there is involvement of the tetracaine. So there is tetracaine, there is bupivacaine. There is tetracaine, there is bupivacaine, then there is ropivacaine. There is ropivacaine, as well as etidocaine. So etidocaine. So all these are the drugs which is long duration. To learn and grow daily like this, please do subscribe.